Hello everyone. Hi all the viewers. Myself, Dr. Amar Thakare. I am an assistant professor at College of Dentistry, Majma University in Kingdom of Saudi Arabia. So first of all, I would like to thank Dr. Malineni and his team at Oral Health Talks for providing me this opportunity to present a lecture at his expert lecture series, a video documentary. So let's get started with today's lecture. So today I am going to present the topic inserting error-free dentures. Okay, so normally we see that whatever dentures are being fabricated, so we should ask ourselves a question like whether those dentures are really accurate and what are the small things that we should take care, so that the dentures which we insert in the patient's mouth and we deliver them, so they are fine and they are in harmony with whatever steps or whatever things you were considering while making the denture. So are we making good dentures, and what can be done as a normal practitioner, as a day-to-day practitioner in our busy schedule, what we can practice and how our communication between the technician, and what are the small things you can apply for making a good error free denture. So we are going to talk about that in today's lecture. Okay, so what is correct centric relation in so centric relation is an absolute necessary, as we all know that centric relation is crucial while developing a complete denture, because the patient has no teeth in his oral cavity and we are trying to give him some teeth. So as we know that centric relation is our point zero from where we start developing the occlusion, right? Because centric relation is a bone to bone relation, it is constant, it doesn't depend on the presence or absence of teeth. It doesn't depend it is it doesn't depend on many factors, and it is a reproducible, repeatable, reliable. Okay, so all these factors are there, so we have to consider centric relation, and it is a must thing what a dentist should be able to record and should be able to refer time and again in every steps of making complete denture. This is the basic thing which is necessary for making your dentures successful. Okay, so in 90% of population what we see is that the centric occlusal position does not coincide with the centric relation position. Now we here need to understand both terms. I hope every one of you are familiar with centric occlusion position and centric relation. So centric occlusion is nothing but the teeth to teeth relation, and centric relation is nothing but the bone to bone relation. Okay, so in complete denture what we try to do is we are going to first record the centric relation, and according to that centric relation we are going to set or arrange our artificial teeth in maximum intercuspation. Okay, so that maximum intercuspation at a given centric relation is our centric occlusion. This is what we try to achieve in a denture patient. But over here what is stated by Posalt is that this is found in most of the 90% of the population. This feature is found in a dentulous kind of setup. Okay, so but in denture we are going to try to uh, make our centric relation and centric occlusion as one. Okay, so how many dentures are delivered after elimination of processing errors? So it's just a mere 10 to 20%. Okay, so like many people, even if they know, because of their busy clinical schedule, don't give that much of priority or that much of uh, what you say is importance to many procedures which could be the procedures which are there while the lab technician is going through. So they don't go through the procedures because they are done in the lab by some lab technician, and the clinician, because of lack of time, he doesn't review the lab procedure, or because of lack of communication, or because lack of following the standard procedure, there can be procedural errors. So we as a dentist should be able to identify the errors and try to eliminate those as much as possible. So why there is this thing like the dentures are being delivered without checking for the processing errors? Is it a mental block? So we need to we need to focus on this point, and it is very crucial for inserting error free dentures. So majority of dentures, as we all know, are made up of heat cure acrylic. This is the main material as of now which are used for making the dentures, and this is a conventional method. Obviously latest technology CAD CAM process dentures are available, but the cost efficiency and the overall setup, it might not be there everywhere. So we rely on the heat cure acrylic resin. So acrylic dub is modified, molded in gypsum mold by split mold technique, and this is the most popular method. Other techniques like injection molding are there, where the processing errors are little bit lesser in terms of this technique. So, but most of the dentures are fabricated by this technique. So several factors play a role in outcome of the denture, right? So these factors are both operator controlled and the technician controlled, because the operator is going to only take care about the clinical aspect, the technician is going to handle the laboratory steps. And so what we need to do is we need to check all the factors. Some of these factors which are responsible by the clinician side are accuracy of impression. So you need to take care that you take an accurate impression. Okay, all the details are recorded, all the eliminating the drawbacks of the impression material is done. So taking care, you should know thoroughly the material, how to handle it, and you should be able to take a good impression. Next is your plaster or stone, which is used for pouring the impressions. So the technician also should be well versed with this material, the setting expansion. He should avoid the air bubbles, voids. Okay, use material which is having a good strength. Abrasive resistant dental stone should be used. And next is your incorrect recording of jaw relation. So all the steps which we do, the clinical steps as well as the lab steps which are going on, so inaccurate recording of jaw relation is a must. Okay, that is the first step of your recording of their centric relation. So that is to be accurate. And next is your mounting. So during the mounting procedure, again you need to take care that there is no faulty mounting. Okay, faulty mounting, faulty programming of the articulator, all these things should be eliminated as much as possible. Then your faulty teeth arrangement. So again, your teeth arrangement, if it is faulty and it's ignored, or you are not giving a balanced occlusion which is indicated in a complete denture patient, that again uh, is a like it can become it can become due to uh, not proper communication with the dental technician, or maybe giving the work to some technician which is not skillful enough. So in such cases you need to properly communicate, and you should give your work to a skilled technician which is well versed with the balanced occlusion, the principles of balanced occlusion, and he knows how to arrange the teeth in balanced occlusion. You as a dentist are going to again go through the occlusion and everything during your train procedure. So without fail you need to not ignore all these things. Then tooth movement can happen during all the things are okay. Then while flasking procedure, other procedures, tooth movement can happen during the setting, flasking, deflasking and packing stage. So the technician has to take care that these movement, tooth movement and everything is eliminated as much as possible. Then processing of denture molds, curing, packing. During finishing and polishing, there may be processing errors, processing stress, warpage, other things which can happen. Again, during finishing and polishing, there might be displacement of tooth or errors which can occur. Then tissue displacement is there, patient related problems are there, dental laboratory induced errors are there. So all these are the factors which are crucial and which determine the outcome of your treatment or the denture. So all these things need to be taken care of. So there should be a standardized procedure for everything, clinical as well as lab procedure, and you should have a proper communication with your lab technician. Then only the outcome will be desirable. So no blame game is to be played here. between the dentist and the technician. You as a dentist, you are the front face for providing the treatment. The patient is not going to understand all the things which are going on in the background, and he is there for a good proper denture, and he expects from a dentist a good denture which is not going to have any problems. And we as a dentist, we need to satisfy the objectives of our giving the dentures. So no blame game, and you have to take the responsibility for delivering proper error free dentures. So tips how to to avoid processing errors: first, understanding the material, procedure, and the patients to minimize processing errors leading to occlusal disharmony. Okay, so whatever we have discussed, those all the things should be eliminated. Then denture recovery from flask carefully without separation. So these are the steps. What you are going to do is, first when you do the flasking procedure, and now when you are going to deflask it, so make a point that the technician has to deflask it without separating the denture from the master cast. Okay, he has to keep the master cast with the denture intact. It should not be, it should not be separated. Next is, he has to clean everything, all the gypsum and all the particles, everything properly from the occlusal surfaces, from the tooth surfaces, whatever flakes are there, whatever plaster or whatever impurities are there on the polishing surface, those should be eliminated. Only the master cast which is there and the denture attached to the master cast, it should be properly cleaned, everything eliminated and kept as it is. Then remove all the everything you have to remove thoroughly. After that, processing errors resulting into occlusal disharmony in denture correction, you have to follow these steps. So first we need to follow the lab steps: lab remount, clinical remount, and milling in of occlusion. So this is the procedure by which you are going to do the selective grinding procedure, and this is how we are going to eliminate the errors of occlusion which occur in the denture. So first we will see about the lab remount. So basically now you have the master casts along with your denture. So maxillary and mandibular master casts are there with your denture. So after that you have to remount it again on the articulator. So after you have finished your trial appointment, everything, the technician usually he is going to demount the articulator. He has to preserve the mounting on that same mounting plates. He needs to preserve it, so proper communication is a must. So preserve the mounting. He is going to demount it, and he is going to do the flasking procedure. After that flasking procedure, the technician needs to take care that he follows the proper standardization technique. He does the trial packing to eliminate the processing errors, and proper mixing of and proper making of the heat cure material, proper duff formation, proper time management, and all that things are to be standardized and to be followed by the technician. Then we are going to remount the maxillary and mandibular cast back on the articulator. So this is done with the help of the previous mounting records which are there on the articulator, and with the help of sticky wax we are going to remount it. Then programming the articulator for centric relation position, and verifying the contact of the incisal pin with the incisal guide table. So here you can see in the figures, we can see that the previous mounting which is present. So while you make indexing of the cast, the notches which you create, so those notches are going to help you relocate the maxillary and mandibular master cast back onto the mounting. So this is what we are going to do, and then with the help of sticky wax you are going to fuse the master cast with your previous mounting. So first we need to check whether the incisal guide pin and the guide table relation, so most of the times there is a gap between the incisal guide table and the incisal pin. So this gap, if it is more than 2 mm, it is advisable to repeat the denture procedure, because the processing errors are so much that it is not advisable to do selective grinding in this case, because you are going to over trim the occlusal surfaces, and this type of over trimming is not advisable. So if it is more than 2 mm, it is better to repeat the denture. So when it is under 2 mm, you need to identify the premature contacts and you are going to eliminate that. So what we need to do is, we take a articulating paper, keep it on both the sides, keep it on both the sides, or you can take a big articulating paper, and you have to just tap the you have to open and tap the articulator on the articulating paper. So over here you can see as in the figure. So this is how you are going to do it. And so the die marks which are going to be placed on the tooth surfaces, we need to inspect those die marks, and we need to reduce the excess or interfering contacts. So how are you going to correct the interfering contacts? Now there are two type of interferences. First is in centric interference, and the second one is in eccentric or the lateral and protrusive interferences. So for both there are some rules which you need to follow, and then only you are going to achieve this selective grinding. So first what you are going to do, first we need to see that we need eliminate the centric contacts. So while eliminating the centric contacts, first thing is you are going to identify the cusps which are having a premature contact. So the cusps which are there, instead of grinding those cusps, we usually deepen the fossa, the antagonist fossa where the cusp is occluding. We are going to deepen the fossa, and we are not going to reduce the cusp. So this law should be followed, the Planger cusp law. So eliminate or elimination of the cusp is not advisable over here. We need to deepen the fossa. Okay, so we need to repeat this until and unless the pin in the centric relation touches the incisal guide table. Okay, so we need to repeat this till it touches the guide table. So here, as you can see in the figure, that centric contacts should be eliminated. Next is your eccentric contact. So here protrusive relation, in protrusive relation you can see that when you place an articulating paper and do the protrusive movements over here, here you can see that some contacts, some premature contacts can be there. So here also you need to eliminate the premature contacts. In lateral, again you are going to have you are going to move the articulator left and right, and you are going to see for the proper marks which are going to be there on the articulator. So now how you go and reduce these contacts? So eliminating high points in eccentric relation, so you are going to follow the Bull's law. So in Bull's law, basically on the working side, so on the working side you are going to eliminate the contacts which are on the non-functional cusp. So here Bull's law, buccal for upper and lower lingual. So these are the non-functional cusp which are there. So any contacts which are there. So when you are on, when you are moving the mandible on suppose left side, so you are going to check for the non-functional cusps which are there and the respective slopes. So for example, the for upper, the buccal cusp is the non-functional cusp. So the lingual incline of the buccal cusp, there you are going to get a premature contact. So on that contacts, you are going to eliminate those contacts on the inclines of the cusps. You have to be careful that you don't grind the tips of the cusp. You have to trim the inclines. So that needs to be taken care of. The vertical dimension should not be destroyed. If you trim the cusp tips, the vertical dimension is going to be changed. So we need to take care that our centric relation and the vertical jaw relation is maintained. We do not have to get over enthusiastic in trimming the cusp tips. The um, cusp's slopes are need to be eliminated. The contacts on the slopes are need to be eliminated. So follow the Bull's law, and on the non-working side, you are going to find interference on the uh, non-working side. You will get the interference on the working, the functional cusps which are there. So there also you need to eliminate the slopes and not the cusp tips. Never modify the mesiopalatal cusp of the maxillary second molar. So this you need to take care. And premature incisal contact, palatal aspect of the upper or labial edges and lower aspect of the incisor needs to be take care when you are when you are eliminating during the protrusive relation. Next, when you are done with all the modifications and all the eliminating of the contact in centric and protrusive record, there you have to take a Facebook preservation record or a remount jig. So here you can see this jig which is attached to the lower part of the articulator, that is called a remount jig. So with the help of that remount jig you can place some plaster, and you have to take the indentation or the imprintation of the maxillary teeth which are there. So here, before you remove the or separate the denture from the master cast, you have to do this procedure. After this procedure only you are going to go for the clinical or lab remount. Then careful separation. After you do the remount jig, then you can carefully separate the master cast and the denture. So after separating the master cast and denture, you go for finishing and polishing of the denture. So now here the denture is finished polished. After finishing and polishing of the denture, what we can do is we need to remount it on the articulator. So now we are not going to use uh, the master casts now. While separating, might be that the master cast can get destroyed while separating the uh, denture from the master cast. So here what we do is, in the denture itself we are going to block the undercuts of the cast, block the undercuts, then apply Vaseline or separating media to the tissue surfaces, and we are going to pour and make a proper casts out of this. So these casts are basically poured in your dental plaster. So these are not the stone cast. So we are going to pour the with the inversion technique you can pour the maxillary and mandibular remount cast. Next is your clinical remount. So you do the remount casting. Now you have this jig which is present with you. So with the help of, to save time, what we can do is, with the help of that jig, you place the denture inside the jig, you place the cast, your cast is there in position, the fresh cast, the remount cast, and you are going to stick with the sticky wax to the previous mounting. So this is your maxillary which is ready. Now the mandibular mounting is to be done after the clinical remount. So in clinical remount, basically this is done. So processing errors which are there are eliminated by the lab remount, and for the clinical errors which is there, we usually do the clinical remount. So what are the reasons and what are the benefits of clinical remount? So if there is any change in the tissue tomography, because there was a time gap between the impression and the denture insertion, so whatever tissue changes are there, those changes or those error which are induced can be eliminated. Next is faulty jaw relation. If during your trial stage some amount of error was there between your jaw relation, that can be eliminated. Obviously, if there is a good amount of error, you have to repeat the whole procedure, you have to repeat the denture. Next, error in transfer of jaw relation or programming of the articulator. If there is some discrepancy, again the error of discrepancy should be minimum, then only it can be eliminated. If the error is more, then you have to repeat the whole procedure. Then tissue resiliency relief effect, because of this also there can be errors, or during the warpaging of dentures during finishing and polishing. So these are the reasons why clinical remount is important and everyone should do it. Now you have the Facebook preservation record. So you are going to transfer your maxillary denture with remount cast on the Facebook preservation record, and you are going to mount the maxillary uh, maxillary cast. So your maxillary cast is now, the fresh remount cast is mounted on the articulator. For mounting the mandibular cast, we are going to take a fresh interocclusal check record. So you are going to, during the insertion procedure, you are going to call the patient. After your patient is there, we are going to take a fresh bite, as you call it. So a fresh bite is taken, and with the help of that bite we are going to mount the, that is considered as your interocclusal record, and with the help of that record you are going to mount the uh, mandibular cast on the articulator. So why is this procedure important, or what are the advantages? So it is a more accurate procedure. So there is minimum patient cooperation. Only while taking a interocclusal record the patient is required, and because it is done, the corrections are done on the articulator, you have a proper understanding, proper visualization, and therefore proper correction can be done. So errors due to shifting of denture in the tissue is eliminated while correcting. So you have a sound foundation, a stable foundation which is there, and because of that you can properly check for any interferences and properly eliminate them. Then correction outside the oral environment. So there is a psychological effect that no grinding of teeth is done in front of the patient. So while when you have mounted the mandibular cast, and you are going to do the exactly same procedure which we had followed for the lab remount. So same, during centric, first check the centric interferences and then check the eccentric. So in eccentric, the protrusive as well as the laterotrusive. So all these interferences are again checked on the articulator. If there is any interferences, if there is no free movement, you are going to do the selective grinding by the same Planger's cusp law and the Bull's law. You are going to follow for eliminating the contact on the working as well as the non-working side. Then maximum intercuspation should be achieved over here. The motto is that, and then at the centric as well as protrusive movements there should be lock free occlusion. So on the articulator itself, you can lift your articulating pin and see for a free movement in your protrusive as well as lateral movement should be free. So to minimize the errors, Hanav had suggested that you do the remounting procedure, like repeat the procedure multiple times, so that you are completely going to eliminate the errors. So as we have seen that lab induced errors are maximum reduced. So 90% of your errors are going to be lab induced, and those maximum of them, those are going to be eliminated when you eliminate the lab induced errors, that is during your lab remount. Other errors or clinically because of the real if effect, whatever you get are going to be eliminated. Maximum elimination is done during your clinical remount. So this he has suggested to do in strained and unstrained jaw relation position. So during the centric, first in the unstrained position means in a light centric contact, and during a strained position is like a most terminal position or most retruded position of your mandible in centric relation. That will be your strained jaw relation position. So you can carry out this in two parts, and here you can see that maximum errors are eliminated. In case of other occlusal schemes which you are using, like lingualized occlusion or neutrocentric concept of occlusion, there where you are going to use a non-anatomic type of teeth, over here occlusal surfaces of posteriors are altered to have harmonious contact occlusal relationship in posteriors and no contact of anterior. So over here you need to take care and eliminate those kind of interferences only. So other method of correcting occlusal disharmony is the intraoral method. In this intraoral method, it is considered to be a more accurate method because the errors can be like the articulator, the mouth is the best articulator, right? So there itself the errors which are being done during the mandibular movement or the jaw movement of in the patient's mouth, those are considered to be more significant, and we can do the same placing of the articulating paper and check for the occlusal interferences which are taking place during the mandibular movement. Then again, a central bearing device or cobalt apparatus can be used for this method, but the most popular method is the occlusal wax method. Here what we are going to do, we are going to take an adhesive green wax, we are going to place it on the occlusal surfaces of the maxillary teeth, and we are going to ask the patient to slightly close his mouth. After the patient closes his mouth, we need to check for penetration of high points. So wherever the high points are there, the wax is going to penetrate, and carefully we are going to eliminate those points. So this is one of the intraoral methods which can be used for correction of occluding interferences. Third one is your milling in occlusion. So this is the last step of a selective grinding procedure. So here what we are going to use is, we are going to use a fine abrasive paste which is placed on the mandibular posterior teeth. This fine abrasive paste which is placed then on the teeth, patient is asked to do mandibular movements, various chewing movements are performed, and this is done for roughly 3 minutes. So a silica carbide paste of 20 microns is used as an abrasive agent over here. So whatever unfinished or uh, unknown contacts which are there, which couldn't be visible or couldn't be eliminated during your lab remount or clinical remount, so during this selective grinding procedure, during this use of abrasive paste over here, all the minute things which are there are going to be trimmed off by this abrasive material. So after this proper harmony is achieved, and the patient is more comfortable, and we have possibly eliminated maximum errors possible in your centric and eccentric relation. So after eliminating these errors, then only your finishing of the final finishing, or the finishing and polishing of incisor and occlusal surface is done by pumice and rag wheel. And after that only you are going to insert the patient and send the patient with these dentures. So these are the three crucial steps which we are going to follow in every case to deliver a nice proper denture. So a complete denture fabrication is not complete without eliminating processing errors. To preserve the foundation for larger period of time and to provide comfort and satisfactory function. So basically three functions which we are going to address here are going to be satisfied, that is your comfort, restoring functional efficiency, and our basic aim, the Devans dictum which is there to preserve the foundation. So we need to preserve the foundation, that should be a primary aim rather than meticulously replacing the missing teeth. So in consideration to that, we come to the summary, and it is unscientific to deliver denture to the patient without eliminating occlusal errors due to processing, as it is detrimental to the foundation. Your rate of resorption is obviously going to get affected if you are going to deliver dentures which are having high amount of occlusal inaccuracy and occlusal instability. So we need to take care during each step of fabrication of complete denture, and as well as the lab communication is a must, and your technicians too need to be well trained and skillful to undergo a proper denture processing. You as a dentist, it is very important to carry on these three basic steps which are there. We need to take care that some amount of time or during the insertion appointment, these things need to be take care, and just not merely correcting the occlusal contacts without any proper guidance. We need to follow uh, proper laws, and we need to follow proper selective grinding procedure in this same fashion which we have described, so that we deliver a good error free denture. So I hope you guys have understood the concept, and I hope that you in your day-to-day practice implement this, and satisfy your patients with a good, functional, comfortable, and a joyful experience for having a complete denture. Thank you so much for your patience listening, and I hope we connect later on with some other topic. Thank you.